Okay. My name is Monica. I will be performing the insertion of a foley catheter on a female for remediation. I'm going to verify the provider order, perform hand hygiene. Good morning, Mrs. Smith. My name is Monica. I will be performing insertion of a foley catheter on you today. It should take about 12 to 15 minutes. Can you verify your name and date of birth? Okay. Do you have any allergies? Okay. I'm going to provide privacy for my patient. Applying clean gloves. Okay. I'm going to raise the bed to a comfortable working height. I am going to place this waterproof pad down. I'm going to cover the patient, just leaving the perineum area exposed. Positioning my patient in a dorsal recumbent position with external hip rotation. I have my soap and water towels. Ms. Smith, I'm going to clean you up. I'm going to touch you. I have my soap and water towel. I am cleaning. New edge. Clean. New edge. Clean. Going to dry. Pat dry. Pat dry. Pat dry. Okay, now I am assessing for any redness, drainage, odor, and skin breakdown. I'm going to spread the labia and look at the urinary meatus. Okay, I assess that. Going to take these gloves off, perform hand hygiene. I am opening my kit. I'm throwing this away. I am going to open this up. Glass flop towards me. Going to just scoot that over a little bit. Turn this around. Okay, I'm going to, inside the 1 inch border, throw this away. Inside the 1 inch border, I'm going to move this over a little bit. Going to grab my first drape, place this shiny side down. Ms. Smith, can you lift up your hips? Thank you. Going to place the fenestrated drape. Mine is already ripped. Okay, just leaving that to where it's only exposing the perineal area. I am going to place my trays inside the 1 inch borders. Inside the 1 inch borders, perfect. I am going to open my lubricant jelly, opening my swabs, getting those ready. I'm going to take the cover off of the foley catheter. I am placing that inside my lubricant jelly and leaving that in the tray. I am attaching my fluid. Ms. Smith, I'm going to touch you and clean you up. I'm going to ask that you don't move as to Try not to break any of the sterile area. Placing my hand, I'm applying a little bit of pressure and spreading the labia. I am cleaning the far labial fold, dispose of that. Cleaning the near labial fold, dispose of that. Cleaning the meatus, dispose of that. I am taking the foley. Miss Smith, I'm going to insert the foley. You might feel a little bit of pressure or uncomfortableness. It's totally normal and it will go away. I'm going to ask you to gently bear down as I insert this foley. Good job. Okay, I do see a little bit of urine, so I'm going to advance 1 to 2 more inches. I am going to anchor the foley, and I'm going to fill up the balloon. Perfect. I am going to gently pull to make sure that is secure. Perfect. I am going to tear the fenestrated drape and throw that away. I will then provide perineal care if needed. I'm going to secure the Foley catheter by the catheter bifurcation, and then I'm going to secure the tubing to the mattress or the sheet, and then I'm going to make sure that the bag is below bladder level by securing it to the bed frame. That looks great. And then I'm going to throw away all my trash in the proper receptacles, provide hygiene if needed, and then I am going to measure the urine. I'm looking for color, odor, and clarity. After that, I'm going to position Miss Smith so that way she's comfortable. Take off my gloves. Miss Smith, thank you so much for letting me help you today. And then I'm going to document my findings and document the procedure.